You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Welcome back to Stellar Success Podcast. Dr. Tudor Francu has Dr. Ramin Rafie today with an interesting story that we're going to divulge, and we're going to go back into different aspects of his life and his professional career. How are you, Dr. Rafie?
Thank you, Tudor. Thank you, Dr. Franco. I'm doing great. I'm happy and very excited to be here and share a conversation with you. I think our life stories are parallel and run very similar to a lot of other physicians who have immigrated to America.
Yeah, that's amazing. And let's start with a little background. How did you come here? What did you do? Where are you now?
So I was born in Iran. I'm Iranian and I happen to be Persian Jewish. So I'm kind of a minority in a minority, and my family immigrated to America in Los Angeles, via Los Angeles in 1980, when the older people might remember the Shah was in charge of Iran and he got kicked out and became an Islamic Republic. Well, that's when they started discriminating against who's not Muslim. And given the history of Jewish people, we don't generally stick around, and we left. So that's when my family and my aunts and uncles, we all came to Los Angeles. My father happened to have had investments in Los Angeles. America was giving 16% interest rate, so he had funneled a great deal of his money to America, and he has even bought some real estate in Los Angeles back in the 70s. So I grew up, I went to UCLA, and after UCLA, I was fortunate to get into my number one choice at UC Irvine Medical School, which is in the American Riviera, as they call it. Yeah. And, I went to medical school very open-minded. And my father had been a dentist, and he took the steps to become a dentist again in America. And he had a difficulty. My older brother actually became a dentist first and helped my dad get his license after my brother actually got his. But 2 years after he got his license, he worked for a year, but then 2 years after he got his license, he got Parkinson's. So he never really worked. And I mean, he worked for like a year, and then he wasn't able to really hold on to a job. And when he was diagnosed with Parkinson's was during my time in medical school. And I remember when I went off to medical school, I was really mad at my father. I felt he was a failure, and I went off to medical school saying I didn't want to be anything like him. But when he got the Parkinson's during my time in medical school, it actually changed my entire relationship with him and how I viewed him. And, out of medical school, I was debating what I should do. I contemplated actually doing anesthesia, which is a very popular field because of its great potential and you have no overhead. But I realized if I was to do anesthesia, I would be at the hospital every morning at 6:30 a.m. And I would be missing out on breakfast for my future children. So I actually opted to do primary care. And I basically went into it knowing that it's my life and I'm responsible for myself and my family, my future family, and nobody else is going to create the life that I want to create other than myself.
Yeah.
So I actually went to the opposite end of the country. I did my internship in Massachusetts. I did family medicine in Ohio, Columbus, Ohio, and I bought a condo there as a resident. I was making good income, and I bought a condo in the downtown Columbus area. And I got my Michigan license, and I started working in Michigan. I was working as a traveling doctor. And
do you still have that condo?
I still have that condo.
Good.
Yeah. The rent has gone up almost every year since I've owned it because it's prime location in downtown Columbus.
Yeah, we're gonna circle back to this investment.
Okay. So I worked as a traveling doctor for 2 years in Michigan, and then I met who ended up being my future wife. And I realized, if she's going to raise our children, she's going to need her family support. So I settled down here, and we bought a house on a lake for less than the price of the condo that I grew up in Los Angeles. This was in 2010. We bought the house. And the truth is, when I left California, I also recognized global warming was happening 20 years ago. And, I viewed myself as leaving California as a one-way ticket. Many people that I went to, UCLA, who all went to school, many of them were native Californians, left California, and a class of 92 people who were all from California. I think there's less than 10 people that are still in California. But anyways, so I worked for a house call company. I was an employee, and I worked very hard as if it was my company, but I knew I was an employee. And because I worked so hard as a doctor in this company, they also had a hospice division, and they made me be a hospice director. I never did a hospice fellowship, but I had very good people. I was hardworking, and they could rely on me. I was a primary care doctor, and I became a hospice director. And the hospice division was actually the most profitable division of the company. They had 20 offices, and my office that I was leading was the number one office in the entire company. So they gave me a second office. This is what happens when you do a good job, is you get more work. But I didn't mind it because it was also more income for me. So the gentleman who started this company started it in 1997. And in 2008, I became a licensed attending physician. And in 2010 is when the Affordable Care Act passed. And that's really when healthcare changed, I think, for the worst for most physicians. He sold that company in 2014 for $350 million.
Oh,
And 2019, Medicare passed the hospital at home waiver because we were part of a large national study that it was more cost effective to provide care in the home, keeping our citizens in the home and out of the hospital. And we were the largest, and we helped establish the hospital at home model of care. And today, in 2025, there's 137 medical centers in America that are all developing their own hospital at home departments. And this is not only a trend in America, this is a trend globally. In Europe, in Spain, and France, all the developed countries are also developing a hospital at home model of care. So in 2019, Medicare passed the waiver, and as we all know, in 2020, COVID came. Well, in 2014, the company who actually bought that house call company for $350 million was an insurance company. I had never heard of Centene, but Centene bought them. And initially, I'll be honest, they pumped money into the company. They helped make the company bigger and better. But what I also recognized, because our former COO became the CEO, and he was the only Centene employee in charge of this enormous organization that had about 3,000 employees, is when we would go and see Centene patients in the home, Centene would not pay us, even though they owned us, and we were helping them save money by keeping the patients out of the hospital. This is only in America does this happen, where you can be a division of the insurance company. Insurance company won't pay you because that's how they do their business. So our CEO picked up the phone and he tried to cut through some of that red tape, and he says, "We're basically going to stop seeing Centene patients because you guys aren't paying us, even though you own us." And they said, "No, don't do that. We'll pay you." And so we continued to see Centene patients. But this was very eye-opening for me as to the true dynamics of the U.S. healthcare system, something that's never talked about in medical school. It's not talked about in residency. And so in 2020, COVID happened. And because we were owned by a large insurance company, we were able to seamlessly pivot to doing telemedicine overnight. So for a year and a half, I worked from home and I did telemedicine. My father-in-law, who is a former CPA, unfortunately got COVID on his 80th birthday. He was very healthy, and he died 2 months before. He died 2 months before the vaccine came out. So a year and a half into the pandemic, Centene did not see an end in sight, and they wanted the doctors to go back in the home and make house calls. And that's when I quit. I did not feel it was safe. I'm the only provider for my family of 4. And I just did not feel it was safe. So I quit medicine, and I was not a doctor anymore, but at that point, 48 years. A couple of things during COVID is I got my MBA, and I became certified in ABAIM. When I did it back in 2018, I think I was amongst the first 200 people in the country. Today, there's 2,000 physicians that have a certification of AI in medicine. So I whether it's naive or what, I thought being a doctor with an MBA and one of the few with the AI in medicine would open up a lot of doors, but nothing really happened. Not many opportunities came knocking on my door. So 2 of the doctors I worked with making house calls also left the company, and they started going to nursing homes with a new company. So I followed their suit, and I worked for that company going to nursing homes. And because I had such a positive relationship with the hospice nurses that I worked with, a lot of those hospice nurses left to go for other hospice agencies. And one of them introduced me to work for the hospice agency they work for. So now I work for that hospice agency. I make nursing house calls, and I'm 1 week I try to build my consulting business as a healthcare consultant physician with my unique background. But the truth is, I also have an 11 and 13-year-old at home now, and they're at a very special age where my time is valuable and their time is valuable, and I try to spend as much time. So during COVID, I did a couple of things. I got my MBA, and I became certified in AI in medicine. And I was initially, I think, one of the first 200 people in the country to get that certification of AI in medicine. And today there's over 2,000 physicians. And I left the company making house calls, and two of the doctors I worked with started working in nursing homes. So I went to that company as well, and I now go to nursing homes. And because I had such a positive relationship with the nurses that I worked with, some of them went to different hospice agencies and opened up doors for me at that hospice agency. So now I work 4 days a week. I go to nursing homes. I go to the hospice. I work less, and knock on wood, I'm making more money than I did before. But I'm trying to build up my own consultancy business as a physician advisor, and it's turned out a lot more challenging than I expected. Building on my experience of the hospital at home, I discovered remote patient monitoring, and I advised two startups in the remote patient monitoring space. And everybody I went to UCLA with is a doctor, and most of them, 90%, are back in Los Angeles. So I have this tremendous network of physicians that personally know me in every specialty. And I've reached out to them. I've even reached out to pulmonologists that I went to medical school with that are at Stanford to get them to adopt this RPM technology. But what I discover is ultimately these physicians are not the decision makers. It's always people higher up in these organizations. So it's proven far more difficult to get these RPM companies adopted, and they remain in the startup phase, but it's proven far more difficult than I thought to help them grow. I thought it would be a no-brainer because there's actually a proven path to profitability. Medicare reimburses for RPM. So there is a reimbursement pattern, but nowadays many physicians, if they come out, they don't want to deal with the Medicare and all the insurances, so they open up a direct primary care practice or direct patient care, and they don't deal with insurances, so they have no reason to adopt RPM. So
this field is it's a new field, but it's an old one in the same time, because I cannot remember anybody doing something like this on the market. Like, I remember one company many years ago coming out with an RPM monitor for all kinds of patients. Like, you can use it in home care, you can use it in the OR, you can use it at home. But it really didn't take off as expected. And I don't know why, because it's so easy to think about this. Why we're using wires when we have, Bluetooth technologies, we have remote viewing stuff, we have, computers, technology that advances so fast, and we're still relying on some 30, 40-year-old technology to monitor a patient. Right. How do you explain this?
I think they're just slow in adoption. I remember when I graduated medical school and I was contemplating going into anesthesia, I had done my sub-I in UCLA for anesthesia, and we would operate on patients that come from the ICU. They had a spaghetti of wires, 12 lead EKG, 4 IVs in them. And this was in 2000. And by then Bluetooth was out. And I said, why don't we have all these leads via Bluetooth? And in 2006 or 7, I finally did a patent search for Bluetooth EKG leads, and 2 organizations, not one, got patents in Bluetooth EKGs. But in all honesty, it wasn't until probably 2018 that I started seeing these Bluetooth leads out. So even for 2010, 2012, 13, I did not see these Bluetooth EKGs. Now that I go to the nursing homes have Bluetooth EKGs, and It's just, I think it's very, very slow to gain traction, and a lot of it has to do because the healthcare system is so splintered. You have the
Yeah.
Medicare system, you have all these third-party payers that are taking advantage, the Medicare advantage or disadvantage of the Medicare system by the advantage, and then you have the doctors that are opening up their own cash-based practices, whether it's functional medicine, concierge medicine, or direct patient care, direct primary care. So
Yeah,
healthcare,
everyone is trying to evade the insurance paid system. That's the
well,
reality.
Dr. Eric Bricker, I don't know if you know who he is. He has a YouTube channel and he's amazing. He has a video out and he talks about how actually the Department of Justice is investigating all these insurance companies because it's clear that they are upcoding and overbilling the Medicare system. But
Yeah,
at the end of the day, nothing's going to happen to these companies, just like in the defense industry. When
yeah,
Lockheed Martin and the Boeing screw up and they mess up, the government's not going to shut them down because at the end of the day, they're huge employers.
right. Yeah. So, Ramin, let's go back a little bit to your roots. What is the mindset of an immigration family, of an immigrant family that comes in this country and try to do the best they can and become, you follow up in your, family footsteps? What is it different in that thinking, in that mindset?
Well, I think in all honesty, even my brother, who's an older generation than I am, he has a very different mindset than I do. Myself being an immigrant, I've been here since I was 6 years of age, since first grade. And maybe part of it is because I grew up in Beverly Hills and I always felt like I was the poorest kid in the class. I always just wanted to fit in and I want my kids to fit in. My brother, who's of an older generation than I am, he went to dental school and he became a business owner. And not only does he own his own 2 dental practices, he made the smarter decision that he owns the strip malls that his 2 dental practices are in. So instead of paying rent, everybody pays him rent now. And I consider my brother to be more successful than his friends who are dental specialists,
Yeah,
because even though he's a general dentist, he learned to leverage the real estate for his benefit. Nobody taught it to him. He made a lot of mistakes, but ultimately he learned and he did that all on his own. And
yeah,
I've seen him do that. And I've thought of replicating that model here in Detroit. And real estate is becoming more valuable. But the truth is, it's nothing like Southern California real estate.
yeah. Yeah, this is a completely different animal, I would say. The medical professionals trying to leverage the real estate investments for their benefit, for the, so-called passive income stream that can supplement their medical income and also provide something, for sure when retirement age comes. What is your strategy in this field?
So my strategy has been to date, I have the one real estate from when I did my residency in Columbus, Ohio, which is a condo. And I have a very diversified stock portfolio that I manage with my wife. And we also started a portfolio for our kids. So I'm more heavily in the stock market than anything else. I own very, very small amount of cryptocurrency. And I have researched buying real estate here in Detroit, in Metro Southeast Michigan, because the truth is this area is booming. And with global warming, I hate to say it, it's benefiting Michigan, and Michigan is going to be a safe haven. But I've tried researching buying investment properties here, and I just really haven't found anything that's worth investing in, to be honest with you. But I still am not giving up. My wife has a real estate license, and we both recognize that if you do real estate right, it can be
Yeah.
productive, and it can provide a nice income stream, but it's a lot harder to do than it seems.
I
So,
see.
um,
Yeah. And the reality is that in general, in medical world, professionals don't have time to either, look at this more closely, get educated better, meet the right people.
they almost need a mentor, just like in
Yeah,
residency when you have a mentor
yeah,
teach you how to do things. I have an MBA, but I almost feel like I even need a mentor in how to start a business, because I've
right,
never started a business my whole life. Even from my first job when I was 14, I've always been an employee. I've been elected to a lot of leadership positions because of my background. I was class president, and I got on these hospice because I was a good people person. But I've never. I'm used to leading teams, and I enjoy hospice because I lead the team, and I think I'm a very good leader. But I've never owned a business, and I've never run a business. I've never had to make payroll, which is its own beast.
yeah. Yeah, and they don't teach anybody in school to do that.
Right.
You go through medical school to residency and you become, someone who can practice medicine very well, but not much else. um,
And that's a tremendous disservice.
yeah,
Nowadays, Arlen Myers, who's an MD, MBA, he's very active with the Society of Physician Entrepreneurs. He makes the comment it should be a core curriculum that every single residency teaches the business aspect of healthcare to all their graduates, and
right.
not as an afterthought, as it needs to be a core competency.
Exactly. Exactly. Because if you look back on all these practicing physicians, they either, they own their own offices, they're partners in their practice with someone else. So in one way or another, they're owners.
Yeah.
And they don't know how to be owners. Nobody taught them how to be a business owner. But that's a whole different discussion. I want to kind of pick your brain on this AI thing that you're very skilled about and you had educated about. What do you think this whole system of home healthcare it's gonna go in the next near future?
It's only going to grow because home healthcare, ultimately it provides service, and it provides a great, and it keeps the hospital in Medicare wants, and that's how the hospital at home model of care has grown to be. There's 10,000 people a day turning 65. It's called the silver tsunami, and there aren't enough nursing homes to even handle this load. So the obvious solution is to take care of people in their home. But I think in about, I'm not sure, maybe 7 or 8 years, that boomer generation is going to go away. And then there's going to be, maybe we're seeing it now, for the first time in history, they're saying there are more sellers of residential real estate than there are buyers. And that's never happened before. So just as the economy is being changed because of Amazon and everything buying things online, I think there's going to be a difference with a lot of the homes, and homes may not be necessarily as valuable as they have been. And home ownership may not be what everybody wants to get. I was
Yeah,
showing my 11-year-old son a YouTube video how Icon Company, which is this 3D printing and concrete homes, partnered with Lennar in Texas, and they built a whole community of 3D printed homes. They're beautiful. Each home costs less than $400. They built it in 2 weeks. In 2 weeks, with 3 people on site. And their goal is to scale it up so that one person supervises 12 robots. So one person supervises 12 homes being built. Those homes are mold proof, hurricane proof, and given the climate change, it's actually far more attractive than having a wooden home built.
yeah,
So I actually think that's really going to gain steam in the next decade, because there is a shortage of not just physicians, there's a shortage of tradesmen, there's a shortage of everybody.
yeah,
And there's a shortage of supplies. There's a shortage of wood. I mean, the price of wood has gone up like crazy. So I could easily see these 3D printed homes, overtake modular homes, overtake mobile homes, because
Yeah.
it's leaps and bounds ahead of technology and safety and the features of these homes.
Yeah, it's interesting how the whole concept of home healthcare for senior citizens is changing so fast. Not because of obviously because of the increase in population of that age bracket, but also of the benefits of it, right? Because I think what happens is that they are not exposed to a lot more like, hospital infections. I would say medical errors, and they're in their own home environment where everybody wants to be at towards the end of the life. Um, how can AI contribute to a better home healthcare for those people?
So there's remote patient monitoring. It basically is 24/7 monitoring, and it produces a tremendous amount of data. So they all have AI engines that sift through the data. Just like when you get a Holter monitor, it might be recording for a week, but the cardiologist is not going to sit there and look at the whole week
Somebody has to.
events. And what's going to happen is when there's enough data and the AI engine gets enough data on each person, it can possibly predict the events before they happen. So that's precision medicine and predictive modeling. When you have risk categorized patients based on their severity of illness, and you catch a CHF exacerbation before it becomes a full-blown exacerbation, and you treat it in the home before somebody has to go to the hospital. One of
Yeah.
the companies I advised, which is called Enlighten AI, the guy who started it, he lost his 20-year-old son to seizures. So he started this real-time monitoring of seizures with an AI engine. And because seizures are very patient-specific,
Hmm.
and it takes weeks sometimes to get in to see the neurologist, and they have to titrate up each time. This monitors seizures in real time, and the neurologist is notified in real time, and they can titrate the medicine in the next day. And then in time, like I said, when they have enough data on the patient, they can possibly predict the seizures before they even happen. That's the goal. Only time will tell when that happens. I personally do not see AI replacing physicians. Ultimately, there has to be a person in the loop, somebody that takes responsibility. Today, in 2025, in Mount Sinai Medical Center, I think is one of the most advanced health systems in the country. Their chairman of the pathology department oversees these big machines that are in the OR. And when they have a tissue sample, they no longer send it to the pathologist. They put it in this machine. And in less than 5 minutes, the machine tells the surgeon if they have clean margins or not. That machine is AI. It's reading this. And pathology is one of those fields where you have a shortage of people want to do that job. So that's one field where AI is going to have a strong footage.
That's amazing.
But ultimately, that machine works under the license of the chairman of the pathology department, whether it's a he or she. The machine cannot practice medicine independently. And the FDA just recently approved an algorithm for AI to start prescribing that, maybe AI can prescribe for like a common cold or simple problems. I mean, I prescribe controlled medications as a hospice director. Ultimately, I've been a hospice director for 14 years. I've gotten very good at predicting mortality, but it's still a guessing game. My job will never be taken over by AI. Whether or not there's enough doctors that want to do hospice is another story.
Yeah.
Because of that, the pay for the doctors doing hospice is going up, supply and demand. But the fields that are affected the most by AI are the image-rich fields like radiology, dermatology, ophthalmology, pathology. Those are easy areas for AI to augment, not replace, augment. But whether or not there's people that want to become primary care physicians, probably not, because there's nurse practitioners and NPs in every state. So in those situations, the AI is going to be as a tool to help them do their job, but I don't see it replacing them. Because even when I go to these nursing homes, the NPs have to be supervised by an MD or DO. Medicare requires that all the H&Ps in all these nursing homes in America all be done by a doctor, not a nurse practitioner. So a nurse practitioner cannot do what I do when I go to these nursing homes.
Interesting. Yeah. Yeah, it's definitely a future for AI right there, like you said. Ramin, with all the knowledge you have right now and the experience and the leadership that you accumulated, if you would look back at yourself, of your younger self, what kind of advice would you give to yourself?
I think people really underestimate the importance of having positive relationships. There's actually a course out called Positive Intelligence. This is never taught in school. This is never taught in professional school. And this positive intelligence is such basic common sense that it should be taught at every single elementary school in the world. It will make all of humanity better. And that is that when life doesn't go the way you plan it to go, sometimes there's a silver lining in that. And you have to find that silver lining. And just as like when you don't agree with somebody, that's okay. There's such a thing as healthy conflict. You can not agree with somebody, but still talk it through to them and appreciate their point of view and maybe change your point of view because of that. But this is never taught in school, and it needs to be taught just for the sake of humanity, because people are so divisive right now, especially in 2025 in America. I mean, you see what's going on in Los Angeles. You see what's going on all over the country. I personally feel I'm a very proud American, but the country has never been as divided as it is right now. And I even think this is something that's would benefit other countries as well. The idea of positive intelligence, and just as like when you don't agree with your spouse, that doesn't mean you should get a divorce. You got to talk it through and you got to figure it out. I go into marriage with the mindset that this is going to work, and divorce is not an option. And if you think divorce is an option, you're going to walk out because nothing goes the way it's supposed to. And even today, my 11-year-old son made the comment that more than half of his friends, their parents are divorced, and probably because they're not bad people, they're people, but they just get enough tired of putting up with somebody else's crap and they're adios. But that's really not a healthy way of dealing with stuff. And America's society is so pressured on consumerism and capitalism that unfortunately I think it does more harm than good sometimes.
Yeah, I agree. I like your perspective on this, and I think positive relationships are a thing that you need to learn. I don't think we're
You need to learn, but nobody teaches you. I'm trying to teach my own kids, but nobody ever taught me.
Yeah, I agree. The art of communication with other people, that's something that it's kind of a lost trade right now, because I'm scared of the fact that this new generations are so embedded in their phones and their social media and their TikToks and their this fairy tale that's out there. They need to look a certain way, they need to do certain things to fit in, and that's not human relationship. That's not a positive communication in any way. And they don't know how to say hi to you anymore, and they don't know how to conversate with you anymore. And that's so sad. at
And
some point.
post-COVID, the schools have really gotten worse. Whether your kids go to private school or public school, everybody I talk to agrees that all the schools have just gotten worse because teaching is another job that's really not appreciated and respected in this society, and that needs to change too. Because just as physicians have a very important job, the teachers have, I think, even a more important job, and they're not highly regarded in the U.S. society.
Yeah, I agree. What's next for you, Ramin?
So I have the initial level of certification of AI in medicine. This Friday, I'm taking the highest level of certification course. It's a 2-day virtual course. Whether I'm able to parlay that into working as a healthcare consultant, as an AI consultant, whether for my current employer as an entrepreneur, to be determined. I have found it is far easier to be an entrepreneur than to be an entrepreneur. So that's how I got my hospice position. I was an entrepreneur. So I might be an entrepreneur again and become a chief AI officer or a fractional chief AI officer. But I love technology. I was one of the first 3 people in my med school class that got a Palm Pilot when it came out, and
I remember those.
yeah, and technology, if it's done correctly, can make life easier. But I find that even with AI, there's more opportunities for hallucinating. There's more opportunities for glitches, and it can actually create. It can be a tremendous source of burnout because of the amount of frustration that I even come across every single day. So,
but I think it's a wave that we cannot
ignore.
miss. We cannot ignore.
And here's the thing: in medical school, they don't teach you to become a business owner. In residency, they don't teach you to become a business owner. But when you get this training in AI, that makes you very unique.
Yeah.
Because every single healthcare system recognizes they have to utilize AI. And AI, if it's done appropriately, it's like a tailor-made suit. It has to be custom made for each department, each organization differently. What works for cardiology at UCLA will not work for cardiology at U of M, will not work for cardiology at Henry Ford. It has to be that tailor specific.
Yeah. And that's the art of it,
That's the art of it.
Because you cannot just chat GPT everything.
No. And ultimately, you need to have a human in the loop that's smarter than the AI, because when the AI hallucinates and says something that doesn't make sense, there has to be a certain degree of common sense that says, no, the AI is wrong. And the physician that has experience, even though they're not getting compensated for that experience, overrules the AI. And that's why I don't think a physician's role is not going away. As to who's going to do a physician's job, I don't know. Because I personally would not recommend my children to become physicians. Today, 70% of physicians would not recommend it to their own children. The people that become physicians are the ones that have no idea what they're getting into.
Yes. It's sad, though, because it's such a beautiful field, and I think most people lose the sight that the main reason we get into this field is to care for one another. And it became so sidetracked in all the specialties. And I think we need to refocus on this and realize that we are here to take care of one another in a way or another way. So, we need to do something about this. Otherwise, we're going to lose generations of young people that they don't want to even consider medicine because of financial reasons, because of, economical reasons, whatever else. But the main purpose is to take care of the other human being.
And the human connection is really, it is important. I've always enjoyed taking care of people of every socioeconomic background. Working in Detroit, I would make house calls in Detroit of poor people that lived in immaculate homes. I'd go to wealthy homes, people who are well educated, but they live in filth. And this is the true society. Is just because you're well educated doesn't mean you're clean or you have good hygiene, and you may not even have common sense.
Oh God, I can't imagine. Ramin, thank you so much for being here. I think people should look more into your work, and how can they contact you?
I'm on LinkedIn. I'm fairly active on LinkedIn. I also have a personal website. It's my first name, RaminMD.com. Ramin MD. That's my brand. That's me. And but I'm fairly active on LinkedIn. And I've done a number of previous podcasts, and each time I do a podcast, I have physicians that reach out to me, and I'm always happy to talk to physicians. Thank you for your time, Tudor. I appreciate your opportunity to be on your podcast.
Thank you. I appreciate too, and hope we can circle back at some point to see where this whole thing goes.
I'm up for doing that.
Are you a busy medical professional striving to excel in life and work? Stellar Success Podcast brings you the habits and insights of top leaders in medicine and beyond. Discover strategies for balance, growth, and fulfillment in every episode. Follow us on Instagram at Stellar Success Podcast for daily inspiration. Start your journey to success today. Subscribe to the YouTube channel now.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.